What is an exchange? What is MNsure? It's a new marketplace where Minnesotans can find, compare, choose, and get quality health coverage that best fits their needs and budget. Nothing like this has existed in Minnesota ever. Nothing like this has existed in our country ever until the Affordable Care Act passed. And what I'm going to try to do is walk you through what's in, the nuts and bolts of the coverages available through MNsure, focus specifically on what that means for us as working men and women, what it means for our local unions, what it means for our families, what it means for our neighbors. We want to make it easier for individuals. Right now, this is talking about people in the individual market or who can be in the individual market to select and enroll in public or private coverage and make it easier for small employers to administer their plans. Going forward, you're going to be able to do it on the web, not take 40 pages to do it. Much, much simpler. Minnesota Care Now is going to be something that spans the difference between fully private insurance, fully public insurance, using both state money and federal money from the Affordable Care Act to make it work. We're going to give people choices. Go to one website, all the plans are going to be there, all the products are going to be there. You put in how much I want to pay, what I want to do in terms of out-of-pockets, and you'll get choices right in front of you. We're going to let you easily put plans side by side, figure out what it's going to cover, and now you're not going to make decisions based upon who had the best marketing drive. You're going to make decisions based upon what is the best coverage for you and your family. A lot of understanding how the Affordable Care Act is going to work comes down to understanding what people make, and in particular, how your family fits into all this. Okay. Feds have something called the federal poverty level. It's determined every year by the Department of Health and Human Services. For a family of one, you're officially in poverty if you make $11,490 or less. Family of two, officially in poverty if you make $15,510 or less. Family of three, $19,500. Family of four, $23,500. And they run this up. Each time you add a kid or some other member of your family unit, the number gets bigger. I'm just showing you the first four. 138% of poverty. Why is this important? This is the new cutoff for adults for eligibility for medical assistance. We have members in our local unions do not make $15,856 a year. I know we have households of members of AFSCME that don't make $21,400 for two, or $26,900 for three, or $32,500 for four. 200%. That's the cutoff for eligibility for Minnesota Care. For an individual making $22,900 or less, they are, at least on the face of it, eligible to join Minnesota Care. Family of two, 31, family of three, 39, and so forth. 275, this is the number under which a child or a pregnant woman is entitled to be in medical assistance. Child meaning 18 or less. Finally, 400%. This is the cutoff for financial assistance through the Affordable Care Act. Kids and pregnant women under 275% of poverty are eligible for medical assistance, regardless of whether they are covered or can be covered under employer-sponsored insurance. We have folks, especially places where the employer is requiring you to pay a fair chunk just of your own coverage, who are struggling to make their health insurance payments, and if they're under that 275, they could be under medical assistance today also. Adults below 138, you're eligible for medical assistance regardless of whether you are covered or can be covered under employer-sponsored insurance. Big change to the Affordable Care Act, there's no longer an asset test for adults for these programs. This is going to make applying for medical assistance in Minnesota Care infinitely easier and I think a lot more accessible. The coverage options are determined by Human Services, and it's a full benefit set. I mean, this is a full benefit set. It's as good a benefit set as anything we have with the best of our employers. No premium, a $2.65 per month deductible, a $3 office copay, and drug copays of no more than $3 per prescription. You got to be a Minnesota resident. For our brothers and sisters that live in Wisconsin, the 138% part doesn't apply. Now, adults between 138 and 200 are eligible for Minnesota Care. And this is the place where this is not as good for our members as MA. But it doesn't apply if you can be covered under affordable employer-sponsored insurance, either as an employee or a dependent. No asset test. Coverage is determined by Human Services. Care is provided through health plans, and there are premiums now. $4 per month per adult, starting at that 138, up to $50 per month per adult, up to 200%. Again, you must be a Minnesota resident. Our kids, the ones that have finally aged off, they're eligible for this in all likelihood. And this is where you go to the individual market, regular health plans, and you will get tax credits to help lower the cost of the premium to you. Your premiums will be capped as a % of your household income. First time we've ever pulled this off for regular working age people in this country. You are entitled to health care based upon what you can actually afford to pay. 6.3% of your income if you're 200% of poverty, 8.05 at 250, 9.5 between 300 and 400%. The subsidy will work by saying, we'll provide you in your household enough federal tax money to be able to buy a silver plan. I'm going to talk what that is later. A silver plan, so that your share of the premium for that silver plan does not exceed that percentage of your income. You can then take that money, buy a plan with less coverage, and lower the premium. You can take that money, buy a plan with better coverage. You have to pay a bit more, but you take that with you. What does affordable mean? The law says your coverage is affordable for you and your family, okay? As long as the employee's share of premium for employee-only coverage is less than 9.5% of their income, not family coverage. The tax credit will go each month to offset the premium, and then there'll be a settle up at the end of the year. Your income changes, goes down, you actually may get some more money back. You hit the lottery, the hot lotto came through for you, $800,000 into your pocket. You're going to wind up paying some of that money back to the feds for their share of the coverage. For individual coverage, you must be a Minnesota resident. So again, our brothers and sisters in the Dakotas, in Wisconsin and Iowa, there will be exchanges in their states, but they will have to apply for whatever is going on in their states. For a small employer, you can enroll all your workers in who work in Minnesota in this, even if some of them live in Wisconsin, or if you're in one of the Dakota border counties. As long as the work is in Minnesota, you can enroll people on both sides of the border in it. The feds came up with, I think this is actually in the law, bronze, silver, gold, and platinum. Of all the claims that come in, how much overall are paid by the insurance company and how much are paid out of pocket by the individual. Okay? So a bronze plan says overall the insurance company will pay 60% of the claims. Our individuals in various forms of out-of-pockets will pay 40%. That doesn't have anything to do with what you will pay on any individual claim overall. Silver, overall the plan will pay 70%. Gold, overall, the plan will pay 80. Platinum, overall, the plan will pay 90. A bronze plan means a $5,000 to $6,000 deductible per person. Okay? Silver, depending on which one, $2,000 to $4,000 per person. Gold, $800 to $2,000. Platinum, $750 to $1,000. Even with the high deductibles, even with the bronze plans, many of the health plans came in and said, we're going to provide coverage before the deductible. We're going to provide 2 or 3 or 4 or 5 office visits or convenience care visits or urgent care visits before the deductible, even if it's a $5,000 deductible. So for the low user, the young person, your health care will actually cover something in return for that premium. Any number of them will cover generic drugs before the deductible with reasonable copays, $10 copay for generic drugs. That's lower than a lot of what we have on our negotiated contracts. Now, it also says $75 for the brand name, but we start with what we got. So even on some of the higher deductible plans here, there will be offerings there which provide first dollar coverage for a lot of the immediate day-to-day stuff. 5 health plans bid. The Blues, Health Partners, Medica, Preferred One, UCare. Preferred One, in most parts of the state, they will be the low plan. They will be the lowest cost plan. Health Partners, major effort. They'll probably be the second lowest cost set of plans in most parts of the state where they're offered. Blues are third. UCare, and then Medica, they're going to be a higher price plan in a lot of places. How premiums are set. These are basically the current rules in the individual market and the small group market now. It's based on your age. The older you get, the more you pay. What the Minnesota law already said, and the Affordable Care Act extended to the country, is that older people cannot pay more than 3 times as much as younger people. The law allows a hit if you use tobacco. The law also said you can have geographic differences in premiums. And that is the case today. In both the individual market and the small group market, there's one rate for the metro, there's another rate for greater Minnesota. What changed, however, and this was the Commerce Department, not anything else, that what has up to now been a single greater Minnesota rating area is now 8 separate areas. No add-on for being sick. And up to now in the individual market, once you were in, they couldn't get rid of you, but they could charge you more because you actually used it. Ditto in the small group market. And no pre-existing condition exclusion, and no one denied coverage before they were sick. People will retire, people just quit, right? But they stay on the plan because they know if they've been sick. And they've already checked it, they already checked out there. They couldn't get coverage in the individual market for anything close to what they were paying, even if they had to pay the full boat with their employer. Those days as of January 1st are over. You can quit your job, you're laid off, you retire, and you're absolutely entitled to get insurance through the exchange or in the regular market, and no one can turn you down for no reason at all, period. Open enrollment runs through the end of March. As long as you are enrolled by December 15th, you will have coverage as of January 1st. In subsequent years, there will be annual open enrollment running from October through December, just like at most of our employers, right? And you'll have special open enrollments available in certain circumstances. You lose your job, because of a change in your income, you're no longer eligible for medical assistance or Minnesota Care, you'll be able to open enroll. Some different rules for members of federally recognized tribes. I'm not going to deal with that today. Small employers can enroll and renew anytime that they're choosing. And individuals may apply and be eligible for Medicaid, and I would add Minnesota Care, throughout the year at any time. Multiple ways to enroll. You can go on the website. I went on it. I got myself an account. Took me 2 times, then crashed on me the first time, but it took about 10-15 minutes. And you can scroll through, look at different plans, find out what they're going to cost, figure out what your tax credit would be, whether you're qualified medical assistance, whether you're qualified for Minnesota Care. There's a toll-free call center staffed by state employees. There's going to be the ability for in-person assistance. This can be a broker, the regular insurance agent. These guys actually do know some stuff that's really good. They can't charge you. You go to a broker, he or she must give you unbiased advice, help you through the process, help you enroll, and they'll get paid by the health plan you enroll in. You don't have to pay. In addition, large numbers of nonprofits are signing up to be in-person assisters. Many counties are having their workers trained as in-person assisters. Some libraries are having their librarians trained as in-person assisters. So you can go to somebody and get free, unbiased advice as to how to work your way through the website. The Affordable Care Act changes the game in some respects. It's just not public assistance over there for those people, and then regular insurance for us. It's all of a piece, guys. And if we've got kids and grandkids and family members who are pregnant, who can get better care for less cost by going to medical assistance, they ought to. We know we're going to have workers excluded from employer coverage, eligible to go into MNsure. DNR seasonals, state intermittents, casual workers, temps, all of our bargaining units have these folks, right? They can't get in the insurance plan. Guess what, guys? They can get in this. I think this changes some of the rules for people taking unpaid leaves or layoffs. People that quit go on to something else. What's the scariest thing about the strike? When the insurance runs out, right? When the insurance runs out, you're on COBRA. That's a qualifying event. Now you're eligible for MNsure. For those couple months, that month, you got health insurance at an affordable cost. Then finally, our early retirees. Most people at Rule of 90 can't afford to go. Why? They can't afford the insurance. Most of our employers don't do bridges to Medicare anymore. We got a lot of early retirees who are eligible to get the premium tax credit. We probably even have some early retirees who will be eligible to be on Minnesota Care. Those healthcare savings plans where you put your unused sick leave, your unused vacation leave when you leave, then use them for healthcare. Two things. You can use them to buy in to pay your share of the premium on MNsure. One. Two, you still will qualify for the tax credit. So we think this is going to make early retirement something, again, usable for our members.
Let's give Pete a big round of applause.